Now, many of you will know how much I love the tucks and tilts sequence for unlocking any restriction in the low back and starting to wake up all of those deep stabilizing muscles. But sometimes I talk about the micro version of this exercise, but I've never actually filmed this, so I wanted to do a short video to explain how I modify this to really find particular control at 1 or 2 levels. Now, this is the version that I personally had to do to master my own spine. I used to manip my back all the time, crack it at least 6 times a day. And I ended up very unstable at 1 or 2 levels. The other levels would kick in just fine, but because of this instability at one point, I would get a huge amount of gripping in the big low back muscles, which would mean that they would be painful almost all the time. Once I mastered the control of these couple of levels, the tension in those big back muscles dissolved almost immediately and my back became much easier to work with. So I'm going to explain demonstrating on the model, and then I'll give you a demo of just how tiny it is when you do it. This is a micro movement. Now, I use one finger, my middle finger, to feel between the 2 spinous processes. This is important because I want to make sure I am actually getting some movement, because from the outside it doesn't look like much at all. Then I bend my index finger and I use the tip of this index finger to feel the big muscles on the side. This is to make sure that the bones are moving, but I'm not using the big muscles to do it. This helps me check that I'm using those tiny, deep little baby muscles on the inside. Multifidus, rotatories, intertransversarii, all of these interesting little names that we've got going on in there. Now, if you find it hard to coordinate that, you can use one hand to feel for the bones and the other hand to feel for the muscles. So I'm going to show you how to do this. I do this with a flexion and extension, a side, and a rotate, and the full figure 8. It does take some time to practice to master this one, so I usually recommend starting off at a level that you can do well and then slowly moving down towards the area that you need it most. So if you've had a disc injury or a stress fracture or a facet joint injury or some kind of injury, don't start at that level. Start a couple of levels above, really get your brain connecting with that area, working out how to send these super fine detailed instructions down there, and then gradually move down towards the area that has had a lot of pain. Remember, if you've had a lot of pain in a particular area, a lot of those stabilizing muscles that you desperately need will be switched off, and it takes a little while to bring these back online. Furthermore, if you get strong abdominal pain, whether this is due to gastrointestinal discomfort or period pain, or you've had a cesarean or other abdominal surgery, you may need to revisit this frequently. So a lot of women have to do this every month to bring their deep stabilizers back online. The difference between a hypermobile woman who's had a cesarean and gets strong period pain compared to a male who never gets any gastrointestinal discomfort, never has pain in their abdomen, and has reasonably stable ligaments will be marked. So please, if you are in this high risk category, spend some time getting this exercise right. So I'm going to lay down on my back. And I usually use my right hand to place my index finger between 2 spinous processes and the index finger in the big muscles on the outside. Now I can make a tiny arch in my back and then a tiny flatten, and a tiny arch and a tiny flatten. Now you probably won't be able to see much from the outside at all, but I can feel when I arch, the 2 spinous processes are coming slightly together, but it's still nice and soft and floppy in the big muscles on the outside. I then soften and let it relax. I like using my free hand to make sure that I'm also not faking with the muscles at the front of the hips, so that I know I am using those deep back stabilizers. I can also do side to side. Now this is not a big side to side movement. It's very tiny. I'm trying to side bend just at that point my finger is, and just at the point where my finger is. This one takes a lot of practice if you've had pain on that side, and again you want to make sure that the front of the hips stays super soft. If you have trouble keeping the hips soft, you may like to put the calves on a chair to soften off this area to let you master this control. When you start thinking of rotation, it's like one side just gets heavy and then the other gets a little heavy. And my left side drops and my right side drops. For those of you who have a scoliosis, this may be much harder on one side compared to the other. You can do the correction that we talk about in the original setup of this exercise. So if it's hard to go to the right, I will go to the left and then tuck and tilt and tuck and tilt and tuck and tilt for about 10 repetitions before trying to rotate to the right again. It's amazing how much this can actually make it a lot easier. When it comes to rotation, the same thing. It's almost like you're taking one vertebral body, moving it up, over, around and down, up, over, round, down. And from the outside, this is barely perceptible, but because I'm using my middle finger to feel for those bones, I can actually tell that I'm getting some deep, deep movement of the spine. Start at a level you can do well, then move down towards your provocative levels. Spend some time doing this before you go into any other activity, and you'll really notice a difference. For me, if I know I'm going to go into a higher level yoga class, if I do this first, my body will feel much more safe going into some more extended positions. If I rush in a bit late and I don't do this prep work, then the body may get a little bit scared and you'll start getting that gripping on the outside again. So please go through this in detail, see how much you can feel this on yourself. Maybe check with a friend so that they can feel your back if you're unsure of what you're feeling. If you're a little bit unsure in the beginning of what you are feeling, just keep trying. It takes a little bit of practice to get the sensation in your fingers, but you want to make sure you can feel the bones moving and be still soft through those big outer back muscles. I hope that helps.